So today, just to revise the pelvis, already I have covered the two batches and one batch we are going to cover. That is A batch mostly. So whatever the pelvis, which is, you have to see that this structure is a pelvis we call. In this pelvis is formed by we are going to get the 4 bones and 4 joints. When you see this is a pelvis, we are going to study under the following heads. What is the introduction of the pelvis? Then formation of the pelvis, formation. Then what are the boundaries of the pelvis? Then we are going to get the divisions of pelvis. We are going to get the parts of pelvis. Parts or divisions. Divisions of pelvis. Then fifth one, we are going to get what is a pelvic brim. We are going to get the brim or the pelvic inlet, outlet. We are going to study. Then sixth one is what is the cavity of the pelvis. How the cavity is formed. Cavity you are going to get. Then seventh one, we are going to get the contents of the pelvis. Contents, in that we are going to get the male and female contents of the pelvis. So under this we are going to study almost all the pelvis. Question will be asked, describe the pelvis, how it is formed, what are the bone forming, that all you have to remember. When you hold the pelvis, as you have to hold the pelvis in the form of anatomical position of the hip bone. When you are going to hold the anatomical position, that is anterior superior iliac spine, pubic tubercle lie in the same coronal plane. So that you are to holding in this way is correct. If you are holding tilted backward or tilted forward, it is little bit tilted forwards, that is. So that is making the anterior superior iliac spine, pubic tubercle, coronal plane. Okay. Then next you have to remember about the pelvis. I have told pelvis is formed by the 4 bones and 4 joints. In this you have to remember this pelvis is formed by the 4 bones. That is the structure which we call as a 2 hip bone, right and left hip bone. Then we have the sacrum and coccyx. Here we are going to get the sacrum, coccyx posteriorly. Anteriorly on the side, both the side, we are going to have that is a pelvis that is forming the 2 hip bone. So 4 bones are 2 hip bone, right and left, then sacrum and coccyx. Next, going to the other part, which is the pelvis, you have to remember. Joints formed by this pelvis. I have told 4 joints. You are going to get the sacroiliac joint. Sacrum and hip bone forming, that is a sacroiliac joint. 1. You are going to get the right sacroiliac joint, left sacroiliac joint. Then you get on the anteriorly, right and left pubis comes, fused together, forming the pubic symphysis. Then posteriorly when you go, this is we call as the sacrococcygeal joint. Sacrum and coccyx, sacrococcygeal joint. Then posteriorly sacroiliac joint, then pubic symphysis. So these are the 4 joints and 4 bones which are forming that is total pelvis. When you see this structure, separately you see the hip bone, separately you have studied the sacrum and coccyx, then separately hip bone. When you study all the features of the hip bone, that you have to consider. Okay. Then going to the in the pelvis, this pelvis is formed by one is 2 divisions, which is we are going to get the formation. This is almost all formed by the bones, muscles and ligaments and membranes. This pelvis totally is formed by the bones and muscles. Then we are going to get the membranes and ligaments. So here, what are the bones forming here? Total pelvis, hip bone and sacrum, coccyx bone. You are going to get the muscles which are attached to the pelvic floor. That is, you are going to get the almost all, including on the pelvic surface. You are going to get that is a piriformis and coccygeus muscle. Then membrane which is closing the obturator foramen, that is a obturator membrane. We have ligament, sacrospinous ligament, which are attached to the sacrum to the spine, sacrospinous ligament, and sacrum to the ischium. Here you have the ischial spine. We are going to get sacrum to the ischium. You are going to get attachment sacrospinous ligament. Then ischial tuberosity to the sacrum, sacrotuberous ligament. So I have told the muscles, bones, ligaments and membranes which are formation in the pelvis. So in this pelvis you have to remember how it is formed: bones, muscle, membranes, and we have the ligaments. Okay. After this when you see this structure, it is having the one plane of inlet about the line passing from the upper margin of the pubic symphysis, to the this is sacral part, which is we call as a sacral promontory, and this sacral promontory to the line passing to the pubic symphysis, and this sacral promontory line passing here, it makes about the degree. You are not making the straight way, it is making the angulation of this one is about 50 to 60 degree. We are going to get this is a very important pelvic inlet, that is making the plane of passing from the sacral promontory to the upper margin of the pubic symphysis. This will make the 50 to 60 degree. That is we call as a plane of pelvic inlet. Okay. Next, this plane of pelvic inlet divides the. We are going to deal the what are the boundaries which are we are going to get the pelvis. When you see this pelvis, on the both the side it is divided by the plane of pelvic. Above the plane of pelvic, which is we call as a greater pelvis or the false pelvis. Below the pelvis plane, which is we call as a true pelvis or lesser pelvis. This is a lesser pelvis or true pelvis, and this is above the plane of pelvic inlet, we call as a greater or false pelvis. This greater or false pelvis, which is a boundary making structure. Here when you see boundary making structure, here whatever the boundary making structure for the false pelvis are the two iliac fossa. Okay, two iliac fossa. Then posterior abdominal wall. You are going to get anterior abdominal wall. You are going to get the one is first one, two iliac fossa, and we have the anterior abdominal wall, then posterior abdominal wall. They are making the boundary for the false pelvis. What are the boundaries making to the true pelvis? Here when plane of pelvic inlet or this is a pelvic brim, we call the plane of pelvic inlet or the pelvic brim. This pelvic brim which is below, we call as a true pelvis. And this true pelvis which is there, it is bounded anteriorly by the pubic symphysis. This is the body of pubic symphysis. Now I am talking about the boundaries of the true pelvis. That is bounded anteriorly by the body of pubis or pubic symphysis. Posteriorly, you know, sacrum and coccyx. On each side, you are going to get, when you each side, that is the ramesis of the pubis and ischium, and the body of ischium. Body of ischium, ramesis of the pubis and ischium on the each side. Okay. So on each side, anteriorly, posteriorly, boundary for the true pelvis. And we have studied anterior, posterior on each side. These two iliac fossa for the boundary for the false pelvis. Okay. Then afterwards, next one is about the division. I have already told this is the plane of pelvic inlet. This plane of pelvic inlet passing from the anterior margin to the posterior. So this posteriorly where it is entering, it is the tip of the or the anterior margin of the sacral promontory. You have to remember sacral promontory and upper margin of the pubic symphysis. Okay. So this is plane of pelvic inlet dividing the. Now I am talking about the division of the pelvis. How the pelvis is divided. Divided into two parts. Above this false and below this is the main true pelvis. That is. Then next going to this, you have to explain this is the plane of pelvic inlet. Now I am talking about the total formation of the true pelvis and what are the boundaries which are forming the true pelvis. When you see this is above this false pelvis, below this is the true pelvis. Then we are more detail about we are going to get the true pelvis. This is true pelvis which is there. It is forming the pelvic inlet and it is having the pelvic outlet. One which is this is a pelvic outlet and this is a pelvic inlet, and this is we call as in a superior aperture. This is a inferior aperture. This is also we call as a pelvic brim, pelvic inlet, and this is a pelvic outlet. Okay, so main important superior aperture, pelvic inlet, pelvic brim, and this is the inferior aperture, and that is we call as that is a pelvic outlet. Okay, so afterwards you have to tell the boundaries of the pelvic inlet. Very important. This you have to remember till third year. What is the pelvic inlet? Because measurements of the pelvic inlet where is very important, and measurement of the pelvic outlet is very important in the obstetrics. You have to remember. So that you have to remember this pelvimetry we call measurements of the all pelvis, which is we call as a pelvimetry. Okay, this you have to remember about the till this third year. Then next going to the pelvic inlet boundary. This is superiorly. This superiorly upper margin of the pubic symphysis or the arcuate ligament. Then we have the pubic crest. Then we have the linea terminalis. This is we call linea terminalis. Anterior margin of ala of sacrum and sacral promontory. Then we have anterior margin of ala of sacrum, linea terminalis, which includes the medial border of the, that is the ilium, medial border of the ilium, and linea terminalis, which is includes the lower part of the medial border of the ilium. Then pubic crest and pubic symphysis. So round the clock, how to explain the pelvic inlet boundaries? What are the boundary which is a boundary line? Upper margin of the pubic symphysis or the arcuate line, arcuate ligament. Then pubic crest. Then we have the linea terminalis. Then which is includes the lower border of the medial border of the ilium, that is we call arcuate line, and linea terminalis, which includes the medial border of the ilium, anterior margin of the ala of sacrum and sacral promontory. How you are going to tell round the clock? Sacral promontory, ala of sacrum, medial border, that is of the ilium, linea terminalis. Then you have the pubic crest or the arcuate line. Then you have the upper pubic crest and upper margin of the pubic symphysis. So once again to revise you, whatever the boundaries which are there, here you have to remember boundaries of the pelvic inlet or the pelvic brim or the superior aperture of the pelvis. Three names. How you have to begin? One is upper margin of the pubic symphysis or the arcuate ligament, then pubic crest, then we are going to get the linea terminalis, but which includes the arcuate line. Then this is the linea terminalis, lower part of the medial border of the ilium, then ala of sacrum, then we have the sacral, anterior margin of the sacral promontory. Then going to the post in the other side, ala of sacrum, linea terminalis, arcuate line, then pubic crest and pubic symphysis, upper margin of the pubic symphysis. This you have to tell about the, that is a pelvic inlet. So when you see the pelvic inlet, when you go to the other part, which is you are going to get the, it is in the pelvic inlet is heart shape in the male. When you see this is a heart shape, then oval or the wider one, which is you are going to get, that is in the females. On this you can identify the pelvic inlet. The given pelvis is belongs to the male or female. So here whatever the on the pelvic inlet, with this inlet you have to tell the, if pelvic inlet is heart shape, so that is we call as that it belongs to the male. If it is a wider one or the oval, then it belongs to the female. Okay. Next, when you see this pelvis, above this plane, false pelvis or the greater pelvis. Below the pelvic inlet, we have the true pelvis. Okay. When you see the total points of the pelvis, in this, when you see, this is a pelvic, this is a pubic symphysis, and this is the one which is you have the sacrum, and this is the coccyx. This is the one which is a pelvic inlet, and this is a pelvic outlet. So here umbilicus is there. This will form the anterior abdominal wall, and this is the posterior abdominal wall, and this is a pelvic outlet. So this will be like a J shape. Cavity will be the J shape, which is almost all posteriorly, which is the cavity is formed in the true and false pelvis, both combined. When is it first directed downwards and backwards, then downwards and forwards. So that J-shaped cavity. So pelvis, which is a false and true, it will forming the J-shaped cavity. That is, you have to remember. This is umbilicus, anterior abdominal wall, pubis, sacrum and coccyx, pelvic inlet, which is making the J shape. So whatever the contains, which is you have to remember here. See, this is a false pelvis. False pelvis, what it contains? Here about 2 iliac fossa, anterior abdominal wall, posteriorly posterior abdominal wall. Almost all the false pelvis contains you get the abdominal organs. All abdominal viscera are situated in the false pelvis. Then what are the content of the true pelvis? We can divide anterior, middle and posterior part. So we are going to get the anterior part of the true pelvis contains on this is we are going to get the first one, urinary bladder. And you are going to get the prostate at the neck of the urinary bladder, prostate in males. Okay, urinary bladder, prostate in males on the anterior part of the true pelvis. Posteriorly, we have the sigmoid colon and rectum. On this posteriorly, we have the sigmoid colon and rectum. Then on each side of the pelvis, we are going to get the ureter coming, right and left ureter. So on each side, ureter, right and left ureter. Then posteriorly, sigmoid colon and rectum. Anterior part, which is we are going to get as in this, that is the urinary bladder and prostate in the males. Then middle part, in females it is very important, so that it is a true pelvis we call. In the middle part, it contains the one which is the important reproductive organs of the female. We are going to get uterus, uterine tube and ovary. In the middle, uterus, uterine tube and ovary in the middle in females, and in the males both the side, prostate only anteriorly, but other urinary bladder, sigmoid colon, rectum, ureter in the both the sexes. Male and female you have to, but specifically female in the middle you have to tell uterus, uterine tube and ovary. So this is the one very important you have to remember, contains of the, that is the true pelvis. Okay, this is what you have to remember in the all pelvis, contains of the true and false. But false pelvis, all the abdominal viscera you have to remember, including anterior abdominal wall it is forming, posterior, but it contains the 2 iliac fossa also. Here it contains the most of the abdominal organ. True pelvis, whatever I have told just now, all they are the content. Okay, this is all about the true and false pelvis, boundaries of pelvic inlet. Then what is the boundaries of pelvic outlet? Inferior arcuate ligament, tip of the coccyx. We have to remember pelvic outlet. This is the inferior arcuate ligament and this is the coccyx. We are going to get the tip of the coccyx. Here tip of the coccyx, inferior arcuate ligament. Both the side we are going to get the ramesis of the ischium and pubis. But mostly ischial tuberosity and body of the ischium, ramus of the ischium. So what are the boundaries of pelvic outlet? Inferior margin of the arcuate ligament, that is the lower part of the pubic symphysis. On the both the side we have the ramus of the ischium and pubis, ischial tuberosity, and posteriorly we have the coccyx, which we are on tip of the coccyx. So this is about the pelvic outlet. This is about the pelvic inlet, pelvic brim, very important, superior aperture, pelvic inlet and pelvic brim, 3 names. This will divide the upper part, false pelvis or the greater pelvis, true pelvis or lesser pelvis. That is a two part which is. Then what are the content? What are the formation? Bones, ligament, membranes, and we have the muscles. So here one pelvic diaphragm is comes, very important. We have the thorax and abdomen separation. We have the, that is a thoracic, that is a diaphragm, respiratory muscle. In the pelvis also important muscle which is a pelvis, we get pelvic diaphragm. Pelvic diaphragm also you have to remember, and all the muscles which are forming, which are attached to the lower part of the hip bone. You get the coccygeus, levator ani, then piriformis. Those all will be making the pelvic floor and including the pelvic, that diaphragm. So those we are making the muscles which are included in the true pelvis. Bones I have told, muscles I have told, ligaments, membrane, obturator membrane, obturator foramen is closed. So this is what about the pelvis. So pelvis we have studied under the, what is the pelvis, how it is formed, what are the bones taking place here, 4 bones, 4 joints making. Then I have told the, what are the boundaries of the true and false pelvis. Then I have covered the, what are the boundary of the pelvic inlet, what is a superior aperture plane which is a 60 degree passing from the upper margin of pubic symphysis to the sacral promontory, 60 degree, and this will plane divide, or pelvic inlet divides the upper part which is a false pelvis, lower is a true pelvis. Then we have told the boundaries of the forming the bones, ligament, muscles and membranes which are forming the true pelvis. Then what are the content of the that is a true pelvis. False pelvis content and true pelvis content. And what is a cavity is a J shape, which is all forming the pelvis cavity, that is a J shape. So this is all about the pelvis. Briefly about pelvis, what is the most important? In the obstetric gynecology, when you study obstetrics and all, these anterior posterior diameters, pelvic inlet diameters are important. We have anterior posterior diameter, we have the transverse diameter, we have the oblique diameter. Pelvic inlet, we are going to get the diameters of the anterior posterior, transverse and oblique. They are very important in dealing the obstetrics. So I have told this pelvis you have to remember from first year to till the third year, because you study the obstetric gynecology in the third year. So in that measurements what we are going to get, we are internal pelvic measurements, outer pelvic measurement. So that we include in the pelvimetry, measurements of the pelvis, which is we call in a pelvimetry. So that is very important. So these are the diameters which are important in dealing the obstetrics case. Okay. So this is one which is pelvis we have studied. Pelvimetry, boundaries, content, cavity, formation of the boundaries of the true and false, contents of the true and false pelvis. So this is about briefly about the pelvis. Okay. Bone to identify, body of pubis, superior arcuate ligament, inferior arcuate ligament we get. Then body of pubis is there. Posteriorly we have the sacraments, coccyx. On each side we have the hip. That is the bones which is. So this is all about the, briefly about the pelvis.